I'm Dr. Sandi Amoils, and I'm a family physician and medical director at Alliance Integrative Medicine in Cincinnati, Ohio. I'm a long-standing member of the American Academy of Medical Acupuncture and actually a board member too. So I'm here to tell you about how acupuncture can be used for the treatment of pain. Many pain conditions are very effectively treated with acupuncture, from things such as an acute strain or sprain, the pain associated with a fracture, for acute or chronic neck, back, or joint pain, the pain perceived from carpal tunnel syndrome, a nerve pain from a neuralgia, a neuropathy, or even the pain associated with shingles. If you've had surgery and are suffering from post-operative pain, acupuncture can be very beneficial. It even helps if you've had a small bee sting that's painful. And in fact, on the battlefield and in combat, soldiers who are injured are receiving a specific form of acupuncture termed battlefield acupuncture. Recently, the American College of Physicians created new guidelines for the treatment of back pain. And in these new guidelines, acupuncture is a recognized and recommended modality as a first-line treatment for pain rather than medication. In addition, other modalities can be used, such as heat, massage, or spinal manipulation. So how does acupuncture work? Well, more and more research is helping us to understand the scientific basis of how acupuncture works, and many studies are showing us the validity of and effectiveness of the treatment process. When an acupuncture needle is placed into your skin, collagen fibers wrap around the needle, cells change shape, chemicals are released locally and in the brain, and some of these chemicals are endorphins, which are the body's natural painkillers, and neurotransmitters. Recently, a study was done at Harvard Medical School on patients receiving acupuncture for the treatment of carpal tunnel syndrome. A functional MRI showing how the brain communicates in an area of the wrist where the pain comes from carpal tunnel syndrome were done whilst these patients were undergoing their treatment. As the patient's pain was relieved with acupuncture, these functional MRIs showed that the acupuncture actually rewired how the brain was communicating this very specific area. I like to think of acupuncture as something that's nudging your own body to turn on its own ability to heal. So how do you go about having a treatment, and what does this process involve? It's great to see a medical physician to diagnose you and make sure that you are treating the correct condition, and then come up with a treatment plan that's tailored specifically to your needs. During an acupuncture treatment, several needles will be placed in your body at many specific areas depending on the type of pain you have. These needles are tiny, you'll hardly feel them as they are inserted into your skin. Sometimes you'll feel a little pinch. The needles will be left in place for about 15 to 20 minutes. Other modalities may be added, such as heat or moxibustion, electrical stimulation, and sometimes we even use something called cupping, or we may place some needles in your ear or some little band-aids which have little beads embedded in them. The number of treatments you need will depend really on how your body responds, what your condition is, and the style or technique of acupuncture that your physician utilizes. If you're suffering from pain, I urge you to try medical acupuncture. It can be really effective, and it has very few side effects compared to the use of chronic medication.